So how do we treat for rabies? Once we have diagnosed a patient with having rabies, we divide them into 3 categories. First category is where the vaccination status is up to date. Here, a medical assessment is carried out by a veterinarian, followed by wound care where the wound is flushed with normal saline or water. Then the animal is revaccinated immediately or 1 month prior to release, and a close observation for 45 days is warranted. The second one is where the patient is overdue for its vaccination booster. Certain laws say that the animal that is not vaccinated properly is considered unvaccinated, whereas other countries say that they are vaccinated properly. Certain other factors to consider include severity of exposure, time since last vaccination for rabies, number of rabies vaccination during the patient's whole life, current health status, and local rabies epidemiology, how prevalent the disease is within the locality. The third one is an unvaccinated patient. According to the National Association of Public Health Veterinarians, immediate euthanasia is recommended. However, if an owner is unwilling to euthanize, an animal must be placed in strict isolation for 4 to 6 months and vaccinated against rabies as soon as possible. During this period, no animal or human contact should be there. How about the situation in Malaysia? The immune belt was established in 1955 between Malaysia and Thailand, where unlicensed and stray dogs were destroyed humanely as part of a permanent and continuous exercise to reduce the persistence of infective hosts. In the event of an outbreak, the area infected can be divided into 3 separate zones. The first one, within 1 kilometer radius of the foci, is known as the infected area, where there is targeted culling of stray dogs and quarantine of own dogs and cats. Followed by the second area, which is a 10 kilometer radius from the infected area, known as the control area. Here, there is targeted culling of stray dogs, vaccination of pet dogs, and restricted movement of cats and dogs. The final area is known as the surveillance area, also 10 km from the infected area, and it's controlled similar to the previous area known as the control area.
If your dog has been in a fight with another animal, has been bitten or scratched by another animal, or if you have reason to suspect that your pet has come into contact with a rabid animal, you should take your dog to a veterinarian for care immediately, even if your pet has been vaccinated against the virus. There is no treatment for rabies, and it is fatal in almost all cases. Early intervention with a prophylactic post-exposure vaccination and quarantining the pet is really the only thing that veterinarians can do in hopes that the body's immune system is able to prevent development of the disease.
These are our references. Thank you so much for watching. So how do we treat for rabies?